Are you interested in knowing your young child in a whole new way? Understanding what's really going on in their developing mind? Does your child say or do things that make you stop and wonder, where did that come from? Welcome to Season 2 of the Hidden Language of Children podcast, where we explore child development and all the stuff that can make raising kids such a challenge. I am your host, Dr. Kimberly Bell, Clinical Director at the Hannah Perkins Center for Child Development in Shaker Heights, Ohio, where we help families guide children to understanding and managing their feelings so they can become the boss of themselves. This podcast is your window into that world. Our guest today is Dr. Tovah Klein. She is the Director Emeritus of the Barnard College Center for Toddler Development, and she is the author of 2 best-selling books for parents, How Toddlers Thrive, and her new one, Raising Resilience, How to Help Our Children Thrive in Times of Uncertainty. It is a pleasure to have you here, Tovah. Welcome.
Thank you. I'm excited to be here.
To get us started, let's define exactly what you mean when you're talking about the word resilience in children.
Yeah, so when I think of resilience, particularly in young children, but children of all ages, it's really how do we think about children facing adversity? So resilience is the ability to adapt, adjust, and be flexible. That's the part that resides within the child. And if you think of a young child, all 3, adapting, adjusting, and flexibility, are a challenge. But that's what's developing over time. And that's what will help them face adversities, little ones, medium ones, big ones over time.
So let's talk a little bit about what that looks like, because what struck me just now is you said this is what develops over time. And I think sometimes people think that when we talk about temperament or something, that there are children that are naturally resilient and children that are naturally overly sensitive or something and sort of lack resilience. So you're looking at it as more of a developmental task. Can you talk a little bit about what that development might look like in terms of a toddler versus a 5-year-old?
Yeah, so I think it's an important kind of misnomer to dispel, which is this idea that either you are resilient or you're not, as if it's a dichotomous piece, or that it's a trait, which it's not. It would be easy if you could just sort of have a potion or a pill and say, here, take this, and now you're resilient. But it doesn't work that way. And so resilience is something that's developing over time. A child might look resilient in one situation and not another, but it's embedded in the parent-child relationship, which in many ways is the good news. It might make parents nervous, like, oh no, one more thing I have to think about. And I always say, no, it's actually not. When you're a loving presence in your child's life, when you're the stability that your child needs, or you get the supports that you need to help the relationship, that's the foundation that helps a child handle all of the, let's call them daily mishaps or misfortunes. So getting out the door in the morning, for example, with a 2 or 3-year-old is a challenge for most people on any given day. The question is, how do you help your child get out the door? Or how do you help them understand that there's no spaghetti tonight, even though you said there was spaghetti and that's what they were looking forward to? And every time we do that and help children understand negative emotions, particularly for our youngest children, starting around age 2, children are facing frustration, anger, disappointments in a way that infants don't. And every time we help them with those emotions, understanding that they're upset for a reason, we can label that. They get better at handling negative emotion. And all of that is part of what we eventually call resilience. But it's not something that goes across every situation. It's not something that happens all the time. And I think we often feel like my child is or isn't resilient. And I would like to lighten up every parent to know sometimes they are and sometimes they're not, just like us as adults. Sometimes you feel like you can handle something, and sometimes you feel like you really can't. And so thinking of it more as this is developing within the relationship, this is developing over time and will continue to develop. The beauty of 5-year-olds in many ways is that they're a little bit more reasonable than your younger children. And so, again, doesn't mean it's going to be easy all the time, but their thinking abilities, their abilities to sometimes calm themselves, which they may not have been able to do before, their ability to look back a little bit. Like when you say to a 5-year-old, remember you got into a fight with this friend before, let's think about what helped. You can't really do that so well with a 2 or 3-year-old, but you could help them sort of recollect that they've gotten through tough moments before. So the good news about development is that they're getting more and more abilities as they get older.
They have more cognitive
Mm-hmm.
capacity to bring to bear, whether it's memory over time, multiple experiences.
Exactly.
There are a couple of things that I always say to parents, which is, helping your child manage a feeling does not mean fix, handle, or changing the circumstance. Sometimes it's just tolerating the emotion with the child
Right.
without rushing to try to fix it and sending the message that your child can't handle it, right?
Right.
But being the sense of confidence in their ability to adapt and be resilient, which seems both simple but is not easy
No,
for
it's not.
parents to necessarily sit in a difficult emotion without trying to fix,
Yeah.
right?
Yeah.
It can be a hard thing to do because you have to be able to tolerate your own internal reaction to seeing your child struggle.
Yeah. I think of it this way. This idea of like, how do we help our child with emotions runs counter to almost everything that maybe any of us, myself included, went into being a parent with. You kind of enter being a parent, whether you plan to be this parent or you're accidentally this parent. We all thought it was about making our children happy.
Yeah.
And if you ask any parent anywhere, it doesn't matter how many resources they have or don't have, it doesn't matter what cultural background they come from. I think just about every parent will say, I feel best when my child is happy. And what we didn't know is that every child knows how to be happy. Like most children, you hand them a lollipop or an ice cream cone, they're happy. Not that it's that easy, but when children have what they want or think that they have what they want, they're pretty content. The problem is our role in life as parents is to help them understand the hard emotions. And it's not always fun, for sure. And just as you're saying, as children get upset, there's actually data on as the child rises, so does the parent. And especially, as you know, Kim, if it's your firstborn,
Yeah.
we tend to be very tied in. I think evolutionarily, there's something there that, but as the child goes up, we go up with them. The question is, can you bring yourself to a place that says, okay, this is not a 3 alarm fire. I exhale myself,
Mhm.
ground myself so I can say to my child, you're upset. You have a right to be upset. I'm going to help you. I'm going to sit here with you. And that's this calming. And what happens is the child actually feels us and feels our calm, but it's not always easy for any parent. We bring histories, we bring our own experiences, we bring everything we lacked, we bring all of our trauma if we had that, and we bring the good stuff. So it's all of the above, right? It's not all negative, but when a child is upset, it's going to go right to the heart of my own, as the parent, emotional experience. And that's really what we're talking about. Like, how do you sit with a child who may be throwing a tantrum over what may seem silly to us, but for that child is really important?
Mm-hmm.
They want to wear that red shirt today, and the red shirt is at grandma's. It's not even in the laundry so they could wear it dirty. It's at grandma's. It's not here.
Yeah.
And then how do you say to yourself, okay, my child's not a rotten human being. My child's not being a brat. They're upset. And I've got to let them be that maybe as I make breakfast. Or for some children, I've got to really hold them or sit with them. but we have to accept it ourselves. And that is very challenging for many, many parents.
Well, and this is kind of a great lead in. Let's talk about your example of the shirt being at grandma's. The one that I commonly see here is the shirt is at your dad's house or your mom's
Mhm.
house because you have divorced parents. And so the thing you want isn't at this particular home. And that can be even more difficult than grandma's house because it brings in guilt. And when you have parents who are lost in their guilt, it makes staying in that emotion even more difficult unless you can recognize what that emotion is. So, what are some of the things you talk to parents about when it comes to guilt?
Yeah, I say guilt doesn't help us. But
Hmm.
most cultures, most religions, most, you name it, bring us to guilt. And when it comes to our child, that's very, very potent. But when I talk to parents, I really do talk about, guilt is not a motivator. It's not actually helpful. And so the more you can come up with in the moment, literally tactics to handle, like, oh, there's my there's that guilt thing, or there's
Hmm.
that piece that gets in my way. Sometimes just giving it a word. I'm blanking on a word right now, but there's that thing
Yeah.
is like a heads up. And then, I talk to parents about mantras. Like, what can you say to yourself that quickly comes to you? And for guilt, it's not my fault. It's really not my fault. So, and if you can get yourself to some place of, it's not my fault and it's not my child's fault, even if you've told them over and over, you love that red shirt, let's make sure it goes back between daddy's house and mommy's house, they're still going to forget,
Hmm. Yep.
right? And
Yep.
so it's nobody's fault. But if you can have a mantra that says, my child's not a bad kid, or this is not my fault, it regrounds you.
Hmm.
Oh, yeah,
Hmm.
here we go again. For one of my children, one of my mantras was, here we go again, just to say to myself, you've been in this before. I'm the
Yeah.
adult here, right? And then you do start to feel the floor under you as the adult.
Hmm.
And you remind yourself, okay, the shirt's at mommy's house or the shirt's at daddy's house. And then you can exhale because you're back in the moment. What guilt does is it takes us out of the moment. It takes us to all this other stuff that we're bringing with us. And we're
Hmm.
forgetting that that little person in front of us who's still really little, even if they're a big kid, they just need us to be right there with them. Yeah.
Hmm. Yeah. And
It's,
I think, some of the decisions that we have to make for children are very difficult. So, some of the families that we work with here have had to make very difficult decisions about early medical procedures, whether it's a necessary surgery at a time that we would not like love for a child to have a surgery, or some other medical or physical difficulty that requires a painful physical therapy session
yeah.
that we know, right? Or getting a divorce. I mean, those are kind of two extremes, but we know in the long run this is what's best for our child. But we also know in the moment that we are creating maybe a little T trauma, right? Maybe not a big, maybe a big T trauma, maybe a little T trauma, but we know it's going to be painful and it's an experience we don't want our children to have. And one of the things that I talk to parents about in those kinds of situations is that it's not necessarily the event; it's how you process that
Mhm.
event before, during, and after.
Yeah.
And here, one of our mantras is that children can get through anything that can be talked about.
I love that because
Mm.
really what you're talking about is when there's nothing hidden, this doesn't have to be a secret.
Mm-hmm.
I can talk about that emotion. You were mad at mommy. You
Mm-hmm.
were angry at daddy. You didn't want your blood drawn, right? And yet you're okay now, and I'm here with you. You can still be mad. Says to them also, I see you and I hear you. I couldn't change it,
Yep.
but to say, I still see your pain. And I put the word genuinely in because I think so often I work with parents where, people have been told, say these three things as if it's like magic. Say these three things, and then they go, but it didn't work.
Yeah, like 1, 2, 3, abracadabra, and all
Yeah,
of a sudden you'll have the best behaved child ever. And then, when it doesn't work for your child, it's like, well, you didn't do it right,
right. I can give you a very personal example. When I had my first child who didn't sleep, and I was, it was around 6 months. I was exhausted, probably depressed. I had this child that didn't sleep, who's now a very capable adult.
Hmm.
And I finally went to Barnes and Noble. This was before social media was like a parenting space. And I looked on this shelf and I pulled out books on sleep, and almost every one basically blamed the parent.
Hmm.
Well, if you have them on a schedule, well, if you feed them this way, well, if you don't do this. And I thought, I cried. And then I was like, I don't need to be blamed. Even if I'm not doing it right,
Yep.
I don't need to be blamed. I actually need help. And
Hmm.
so that's partly the role you play, or I try to play, in how do we help parents really understand you're doing the best you can, and we can help you shift to see this child in front of you. Um, and hopefully we can help you have a little more self compassion, because being a parent is hard. There's
Hmm.
no question it's hard. And you don't know when it's going to be hard. Maybe it was hard from the beginning, or maybe it wasn't. And then it got hard, but it's going to be hard, and it's going to push for our experiences and our pasts in a way that I think nothing else does, really.
Yeah, I would agree. And I'm thinking in my head of um, many of the sort of the thinkers that focus the way that you do on sort of understanding the deeper thing, that this isn't about, we're not talking about behavior or modifying behavior here. We're not talking about finding an it or a diagnosis. You're getting to the root of the importance of the
Right.
relationship between the parent and the child, which does two things. It's both scary because then it feels like such responsibility, but when it's done through compassion, then it becomes empowering and powerful.
Yeah.
And I think it's important to know that this relationship that you talk about between the parent and the child, and sort of the being there with the child, doesn't mean that you don't work outside of the home.
Right.
That's not what we're saying here. We're not saying the being there emotionally and being sort of consistently emotionally attached to your child is about quit your job if you're going to be a
Right.
good parent.
Right.
We're not
Yeah.
like, right? We're not saying that. That it can be done in a multitude of circumstances.
Yeah, for sure. I mean, it's a really important point. And I think the piece that gets overlooked sometimes when we talk about being there or what relationships are is that as children get older and they do, what we call internalize the relationship, what we mean is, even if they're at school and they're struggling, with a peer situation, or they feel lonely and they miss the parent, it's, can they say to themselves or get some comfort in, mommy still loves me, daddy's going to be home when I get home. It's this
Mm-hmm.
idea that children carry us with them. I would think of it as, whose voice do they hear in those moments of upset,
Mm-hmm.
right? Do they still hear that they're loved? Do they still feel like someone's going to take care of me even if I do all these bad things, like throw the toy or kick my friend or not listen to the teacher or the caregiver? And then the reunion, when parents do come back, either to pick them up at daycare, at school, or come home at the end of the day, it's that reunion that brings the child back to, I am safe. We are okay.
Mm-hmm.
Um, and we underestimate the reunion. We talk so much about separation that we
Mm-hmm.
forget that there's also, at the end of the day, if you do work or you do have other things in your life, which I hope every parent has something beyond their children,
Yes,
um,
yes.
that it's when you come back together, and that hooks into how we talk about repair. It's not the thing that upsets your child with you or the time that you yelled at them that matters so much. It's, can you come back together and say, wow, we had a rough time, the two of us, and I shouldn't have yelled like that. I'm sorry. I
Hmm.
always love you, even if I yell. And even if your child gives you the cold shoulder, because they sometimes do, they're like, well, I'm not ready for you to come back. They've heard it, and eventually they come back to the parent. You hug them and you say, yeah, that was rough. And,
Yeah.
we're still together. We still love each other. Then children learn about anger. Anger is part of a relationship. Anger
Hmm.
is, something that happens in this loving relationship. That's where resilience comes from. I'm going to be okay even when really bad stuff happens.
Yeah. One of the things that we do in our preschool, a lot of the kids that we work with would have what people would call separation anxiety that made it difficult for them to be at other schools. And so they come to us, and we have a rather lengthy settling in process where the parent waits in the waiting room and the child can go back and forth from the classroom to the waiting room. And then the parent goes on a walk and they come into the classroom and they say, I'm going on my walk now. And then they go to the window, they go to the parking lot, which happens to be right outside the preschool window. And they go to the parking lot and they wave through the window. And then when they come back from their half-hour walk, then they come back in the classroom and they say, I'm back. And then they go to the waiting room where they wait again, because sometimes we have to redo that process,
Yeah.
right? Because something has come or something has been difficult. And that the message there is two things. One, parents always come back, right? Parents always come back. And you can manage things in bearable bits.
Yeah.
And sometimes you've had to manage it in big bits because somebody has passed away or something like that has happened. But you can learn in bearable bits to manage, these kinds of separations. But you hit on something that I know we wanted to talk about before we run out of time, and that is the notion of repair. And you said, even if your child is giving you the cold shoulder or says, I hate you, or, one of those other things that might happen in those moments, that the parent really holds the love for both of them. Like, I know
Right.
you love me and I'm going to hold the love for both of us. And the two-way feelings, as we would call them, right? The
Hmm.
ambivalence. So talk about your concept of repair and how important that
Hmm.
is in the relationship.
It's a really deep process, even though on the surface it may not seem so deep, which is young children count on parents in a way that I think it's hard for a parent to even fathom. And it's so deep for the child. Like, I need to know that I'm still loved, even if I do whatever bad thing they've done or they're even thinking about. I'm mad at my parent because, and so the repair really is, I mean, I think of it like if you think of a break or a rupture, two things come apart. And that's very scary to a child. Even if they've screamed, even if they've said horrible things, depending on their age, even if they've thrown stuff, that coming apart and the thought that they've lost the parent cuts to their core of, I won't be safe in this world, I'll be alone. And so it really is up to the parent to, in some way, say, I've got to be the adult here. And then you say to the child, I got upset. I shouldn't be this upset. And I still love you. I'm going to take a minute. And then you go back
Mm-hmm.
to them. And children often fall into our arms. Not all children. That's where you get into personality or temperament. Like,
Right.
some children are so relieved that they just sort of bury their head in you. Other children are like, I'm not so sure of this, or I'm still mad, but they hear it. I am still loved. And you can say to a child in that repair, I still love you. Even though I'm going to make you put your shoes on, or even though I said things that I shouldn't have said, I still love you and I always love you. And I think the piece that's often maybe hard for us to understand as adults is we love our children. And even when we're really upset with them, if there was a way to like stop the parent in real time and say, oh, whoa, you're really upset. Do you love your child? Almost every parent is going to say, well, of course I love her. That's not the issue right now.
Mm-hmm.
But if you stopped a 3 or 4 year old in that moment and said, do you love your parent? They're going to tell you no.
Yes.
Because for a young child, this is the developmental piece. These dichotomies are dichotomous. I love you or I don't love you. And if you're not letting me do what I want to do, I don't love you.
Hmm.
Right. But a few moments later, I do love you again. And they don't
Hmm.
understand that love is like, oh no, the love is always there. That's up to us to let them know. Even when I'm having a hard time as a parent, even when you're having a hard time, I still love you, which
Hmm.
helps children then start to accept I'm good sometimes, I'm bad sometimes. It's part of being me. And doing, quote, bad things, whatever the child thinks is bad or the parent thinks is bad, is not the end of the world. It's
Yeah.
just part of being a kid.
These are the things that are not in the manual. The ability to hold two feelings at the same time is something that develops over time. Your
Yeah.
child doesn't have it, but you have it.
Right.
So when they say they hate you, and yes, it's very real in that moment, you are the one that holds the two-way feelings. But the child loses the loving
Yeah.
feelings, and the parent has to hang on to that. And that's what we call the two-way feelings,
Yeah.
right? Like soon you're going to remember that you love me. And I
Right.
love you, and for now, I will remember for both of us.
Yeah. And to not expect the child to be able to feel that or express that right then and to know that that's normal. I
Yeah,
think it's
yeah.
very scary for parents when children are that upset and saying, I hate you, or you're the worst, you're the
Mm-hmm.
worst mommy ever, you're the stupidest daddy, whatever they throw at us. It's not that they're necessarily going out in the world and saying the same thing. They feel very safe.
Yeah,
Even when there's been conflict in a relationship, if they're grounded in safety, they're gonna let those feelings out at home usually.
yeah, more than elsewhere because they're too vulnerable elsewhere.
Yeah.
So, okay, there's really so much more in your book that we obviously do not have time enough to touch on even, but you do go into a beautiful amount of depth about all the different ways that parents help their child through their relationship become resilient to things that can happen in the world. That you talk about COVID or something like individualized like a divorce or when we have school shootings. And I mean we have a lot of things that kids have to be resilient for
Yeah.
these days. And I really like the way you go into the categories of all the different ways that you can help your child to develop resiliency, and you give very nice examples. And so as we're talking about it sort of as the theoretical underpinning of all of this, your book does get nice and specific about ways that you can be helpful and what that actually looks like,
Yeah.
which I really appreciated when I was reading it. I know that it comes in this nice hardcover book. I also noticed that it is on Audible
Yes.
and it's on Kindle as well, right?
Yep.
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 So it's
All the
on all the
formats.
ways. It's on
Yes.
all the ways
Yes.
and
You
all
can
the
read, you
formats.
can listen, you can scroll. Yeah.
It's accessible, and I think the book is accessible to parents in terms of its content as well,
Thank you.
which I really enjoyed. So let me do a quick commercial. And so, if you are a parent in the Cleveland area and you like what you hear about our approach to early childhood education, you might consider enrollment for your little ones in our toddler group or preschool. Hannah Perkins was an early pioneer in social emotional education way back to the 1950s when we were still calling it nursery school. So, our school has rolling admissions. So, we are always giving tours and taking applications. And you can get lots more information at our website, hannahperkins.org, for those listening, HANNAPERKINS.org. All right, Tova, this is a section that we call Let's Rephrase That. And this is where we talk through things that sometimes grown-ups say to children when they are themselves dysregulated, right? Maybe we're a little emotional, or it's the first thing that comes out of our mouth. And we kind of talk and come up with alternatives that might be a little more helpful in the development of resiliency. You ready to give it a try?
Sure.
Okay. So, the family dog has just been diagnosed with cancer and has to be euthanized. While mom and dad are reeling at the news, their 5-year-old daughter doesn't know anything about it yet. The first instinct for just about any parent would be to handle the sad duty without telling the child and explain the dog's absence afterwards by saying something like, "The dog has gone to live on a farm in the country." How would you suggest handling that a little bit differently?
The first thing I just want to say is I always think the death of a pet even if it's a fish, is really important for children to learn about life cycle.
Yep.
And so I think you always come from a place of compassion. And I would say to those parents, you don't have to do it immediately if you've just gotten this diagnosis. Like, you wait a day or two or however long you have until you're ready. And then be aware of a couple of things. Your child will be sad, but not as sad as you are. Because death for children has very different meaning. So the first thing to do is approach it by saying, we have something sad that we want to tell you about. Right? It frames it a little bit. It
Mm-hmm.
says there's some information we're about to give you, and it kind of primes their system of like, oh, what's going on? And then you say, our doggy is old, very, very, very old, because I think you want to put it in a category of it's not us, because what do children think when they hear someone's sick or might die? What about mommy and daddy? That's the core of their life. And so you can explain that the dog is very old. She has a doggy sickness,
Mm-hmm.
and the dog doctor, called the vet, doesn't think the dog can live very long. And that's making us very sad. And we're going to have to say goodbye. And I don't even think you have to get into the details of what that is, although for some children, they will ask
Yeah.
details. But it's the idea that you put it out there and you say to them, I'm going to walk you through something sad and hard and maybe their first loss.
Mm-hmm.
We're going to be here for you and we're going to be honest, because you actually build trust in children when you say, hard things happen and we can talk about them and we're going to help you through it. And then you have to use at some point the word death, which people, certainly in American culture, are very uncomfortable with. Saying the dog's had a nice life, we have lots of good memories, the dog's going to die. And that means we're not going to see the dog anymore. We can remember, we can look at pictures, we can talk about good times, but we won't be able to see him anymore. I think one of the hardest parts for parents, and I always say this to them depending on the age of the child, I say they're going to get over it much quicker than you. And very soon, I'm just
Yeah.
preparing you, they're going to say, can we, let's say the dog's name is Charlie. Can we get another Charlie?
Yeah.
And I say to the parents, that's going to hurt you because you know that this is one particular dog that's played a special role in your life. But your child has a concept of, okay, well, Charlie was good. We can get another one. But the other piece to this is to assure children, even though this is sad and you might have other feelings too, you can tell us about any of those feelings. You can express
Mm-hmm.
them. You might be confused. You might feel some anger. But mommy and daddy are here. We're going to still have dinner together tonight. We're going to still put you to bed. It says to them, the rest of your world is really staying. And I'm sad. And sometimes you might even see me crying a bit over the dog, but I'm okay. And
Mm-hmm.
I'm going to still take care of you. That is the heart of what children need.
Yeah. That's really that's beautiful. That statement of it's going to be hard, you're going to have feelings, I'm going to have feelings, but I am still here for you.
Yeah.
I am still your parent, and we're still going to be doing the parent job
Yeah.
in all these other areas of life. And one of the things that I say to parents is, when we talk about telling them the truth, we're not talking about overloading them with
Right.
details.
Right.
Allow the child to ask the question. And if you feel like you're not sure what they're asking, then I always say, well, what do you think?
Yeah.
So that they can tell you what their potential distortions are, right?
Yeah.
What their worries are, what they're most afraid of, what they think might
Right.
be happening. And then you can, gently correct
Right.
those misconceptions of whatever they maybe put together in their head.
I would say to also appreciate that along those lines, every child has their own nuance in this, their own things that they're going to think about, right?
Mm-hmm.
This might sound scary to one child and absolutely not to another. And one might have many questions over time. They'll come back with questions. You have to be ready for that. A parent might think, oh, she's totally fine. She's not even thinking about it. And then 3 weeks later, they're like, can we see Charlie again? Where's the dog?
Yes,
And you're like,
yes.
wait a minute, didn't we have this conversation? Yes, you did, but today she woke up, she's like, where's my dog? And so then you have to
Yeah.
kind of go through an abridged version. And again, that's part of the process. It's a process.
It's part of integrating the truth and
Yeah.
reality.
Yeah.
Yeah. Over fantasy. That
Yes.
changeover that occurs right around 4 or 5 where can't just wish Charlie back.
Yeah.
Yeah,
Yeah.
yeah. Thank you so much for being with us. This has been really, really enjoyable. But that is our time for today. If our conversations here raise any questions for you, or if you have parenting concerns of your own, you can do a couple of things. You can share them with us here. We're happy to answer your questions on the air. You can send questions by email to the hidden language of children at gmail.com, or visit our website at hiddenlanguageofchildren.org. If you feel like you might need a little bit more coaching or help talking to your children about something difficult, you can also come to the Haddon Clinic here at Hannah Perkins, and you can give us a call at 216-991-4472. And we hope you have enjoyed this conversation and found something to take away from it. The Hidden Language of Children podcast is a production of the nonprofit Hannah Perkins Center for Child Development in beautiful Shaker Heights, Ohio. Our producer is Bob Rosenbaum, and Dan Ratner is our consulting producer. If you like this podcast, please subscribe to hear future episodes, and please share it with all your friends and family. I am Dr. Kimberly Bell, and we will see you next time.